From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Amarachi Ubani.
Good evening and welcome. NCDC confirms 14 new cases of COVID-19 in Nigeria, bringing the total number of confirmed cases to 111, as President Muhammadu Buhari announces lockdown in Lagos, Abuja and Ogun states as precaution against spread of the novel coronavirus. Chief of Staff to the President, Muhammadu Buhari, Abba Kyari, confirms testing positive to coronavirus, says he will be moved to Lagos for further treatment and will resume work soon. Chairman and Vice Chairman of Fanfa Oil, Mudupe and Folorunsho Alakija donate 1 billion naira to support government's efforts at fighting COVID-19. And the UK's health authorities say it may take as long as 6 months before life returns to normal in the United Kingdom following outbreak of the coronavirus. Plus sports stories. Nigeria's COVID-19 cases have risen to 111. This was announced tonight by the National Center for Disease Control, the NCDC, on its official Twitter handle. The NCDC gave the breakdown that there are 14 new cases of COVID-19 reported in the country, with 9 of those in Lagos and 5 in the FCT, bringing the total to 111, and still with 1 confirmed death in Nigeria. A breakdown by the states as follows: the Lagos State with 68 cases now, the FCT 21, Ogun State 3, Enugu, Bauchi, Edo, Osun States 2 cases each, Ekiti, Rivers, Benue and Kaduna States all have 1 case each. Also today, the president broke his silence on the novel coronavirus outbreak in the country with a first major broadcast to Nigerians on his government's action to contain the spread of the disease. First, he announced a lockdown of the federal capital territory, Abuja, the commercial city of Lagos and neighboring Ogun State for the next 14 days. Then he ordered the redeployment of port health workers to join other medical officials. 3-month moratorium for SIP beneficiaries, 2-month food supply for internally displaced persons, the conversion of the federal government stadia to isolation centers, and restriction of movement of private jets. Those are the major highlights of the president's first broadcast to Nigerians today, a decision which sets a new tone on the fight against the dreaded COVID-19.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states. All citizens in these areas are to stay in their homes. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states. This order does not apply to hospitals and all related medical establishments, as well as organizations in healthcare-related manufacturing and distribution. Furthermore, commercial establishments such as A, food processing, distribution and retail companies, B, petroleum distribution and retail entities, C, power generation, transmission and distribution companies, and D, private security companies are also exempted. Although these establishments are exempted, access will be restricted and monitored. Workers in telecommunication companies, broadcasters, print and electronic media staff who can prove they are unable to work from home are also exempted. All seaports in Lagos shall remain operational in accordance with the guidelines I issued earlier. Vehicles and drivers conveying essential cargoes from these ports to other ports of the country will be screened thoroughly before departure by the port's health authority. Furthermore, all vehicles conveying food and other essential humanitarian items into these locations from other parts of the country will also be screened thoroughly before they are allowed to enter these restricted areas.
That was earlier this evening, President Muhammadu Buhari announcing the new measures. With the president's declaration, many Nigerians, especially those who live in the FCT, Lagos and in Ogun states, will probably be spending Easter at home. The Minister of Health, Dr. Osage Hanire, describes this as a sacrifice considering the health emergency in the country.
It's a very good thing to do, that to spend Easter at home. And be able to be with the family. Probably it's downtime from work for some people. But on the whole, as I said, if it's a sacrifice for some people, it is well worth it. The country requires really to have most of the citizens in Lagos and Abuja to be in their homes, and Ogun State also, in order to reduce the risk, because there is clear evidence that the more people mingle together, the larger the crowds, the denser the crowd, the higher the risk of transmission of this disease. We have seen that in various other countries, and we have also seen measures that other countries applied in order to be able to tackle this outbreak in their own places. So that is a very good and worthwhile sacrifice if you have to spend Easter where you hadn't planned to spend it.
The Chief of Staff to the President, Mr. Abba Kyari, has spoken at last about his health status following a coronavirus test for which he has now personally confirmed positive. The President's aide, in a statement, says that based on medical advice, he will be transferred to Lagos today for additional tests and observation, though he had been in self-isolation since learning of his health status. Mr. Kyari says he will be paying for the treatment from his own pocket in order not to burden the public health system, although he claims he has not experienced high fever or any other symptoms associated with the coronavirus. The President's Chief of Staff adds that he has been working from home since he tested positive for COVID-19, but hopes to return to his desk soon, assuring colleagues that he has colleagues as backup who are young, professional, knowledgeable and patriotic and are working 7 days a week to serve the President and the people of Nigeria. As the number of cases for COVID-19 continue to rise in the nation's capital, many churches are complying with the order from the FCT minister to shut down all places of worship in the Abuja Municipal Area Council to begin fumigation of parks and markets. Our correspondent, Kayla Megwa, reports. We'll have the story from Kayla in a minute, but two more high-ranking government officials have confirmed testing positive for the coronavirus. They're the Controller General of the Nigeria Immigration Service, Mohammed Babandede, and the Chief Medical Director of the University College Hospital, Ibadan, Professor Jesse Otagbayo. The status of Mr. Babandede, who has been in self-isolation since his return from the UK, was confirmed in a statement today. According to the statements, the immigration boss had complied with the NCDC instructions to self-isolate and undergo tests, which came out positive. He's, however, set to be active in directing the affairs of the service online. Professor Tegbayo also confirmed in a statement he personally signed that he tested positive for COVID-19, but says he remains in isolation as he is not symptomatic. The CMD is also asking staff who have been in contact with him during the period to immediately proceed on self-isolation pending time that they get tested. Let's talk some more now about the president's new measures as well as where we are with the coronavirus tests and the recoveries. We're being joined now by the Director General for the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu, who the president expressed his pride in, saying he's one of the 10 global health leaders appointed by the World Health Organization to study China's approach to the pandemic. Dr. Ihekwazu, thank you so much for joining us on the news at 10 tonight. We know long days, long nights for you. We understand, and we do appreciate, all the work you're putting into this. Now we have a lockdown in two major cities in Nigeria, Lagos State and the FCT. What does that mean then for those who are currently in isolation and those that may come up with symptoms of COVID-19 during this period?
Yeah, thanks, Amarachi, and good evening, Nigerians. What we learned from the trip that you referred to, our trip to China a few weeks ago, is there are interventions that do work. We've seen a large outbreak in China, but we've also seen the most astonishing reduction in cases in that country over a short period of time. Now, what did they do? They implemented what are called non-pharmaceutical interventions. So really appealing to the people of China that they needed to sacrifice on behalf of their country. What was that sacrifice? It meant staying indoors for long periods, stopping mass gatherings, and carrying out personal hygiene, keeping your hands clean, and just generally increasing the distance that we have from each other. Now, these are not easy measures. They were not easy in China, and they will not be easy in Nigeria. But it's a price that we have to pay. And the big thing that I learned from China is that for these to be effective, we have to take the people with us. So we need Nigerians to work with us, because it is not something you're going to do for the government or for NCDC or even for Mr. President. This is something we have to do for ourselves and for the survival of our country and its people. So Mr. President's appeal today, and the reason it has taken so long to do, is because these are not easy measures. And as a leader, he had to really think carefully on the implications of these measures on our way of life, way of life in Nigeria, of how we exist. So some preparations had to be made. These have been made over the last few weeks, and now we have to implement these measures. So I'll join him in appealing to all Nigerians to come along with us, to work with us, to do their bit, to hold each other accountable in our society, in our villages, support each other. But the most important thing, over the next 2 weeks, the success of our measures depends ultimately on how much Nigerians work with us, work with Mr. President to see that we're all kept safe and we can reduce and bend the curve of transmission of this outbreak sooner than it's happened in most other countries. This really is our challenge as a society over the next 2 to 3 weeks.
A challenge indeed, Dr. Ihekwazu, because you might have to keep repeating these instructions over and over again. The issue of testing and the rate at which it's coming, will there be an increase of testing in the coming days, as we've seen in some developed countries? Because the main purpose of people staying indoors, of course, is so that you can identify quickly those who have been infected and those who are showing symptoms or not. How quickly can the testings be done, and do you have enough kits for these?
So Amarachi, this is a very important question and one that we're confronting hands-on. All across the country, both in existing labs and in new labs, we're working extra hard to roll out, increase the throughput of testing, bring new labs on board. Unfortunately, this is not something that you can plug and play. It's a very difficult process. I equate it to people saying, why don't we have power? Why can't you build new power plants? Unfortunately, these things can't happen overnight. So we're working very hard. On the other hand, we really need the cooperation of Nigerians. We need to test those that require the test. We have publicized new case definitions today. Go on our website, visit our Twitter handle. There are people that need the test. But by running to NCDC when you don't need the test, you clog up the system. If you're asymptomatic, even if you're a contact, please stay at home. We only need to test those that become symptomatic while in isolation. And for them, we want to go over and beyond the call of duty. But we can't do that if the entire system is clogged up by the worried well, as I call them, looking for the test, driving around and using bad words to describe the work that we do. So please, Nigerians, listen, we are working. Everybody is working 24/7 to increase the throughput of testing. There are a lot of things going around. Rapid diagnostic test kits being bandied. None of them work. If they work, I would go to bed and my problem will be solved. But I cannot advise on the use of test kits that I have no idea if a positive is a positive or a negative is a negative. So Nigerians, please be patient. The team is working round the clock to make sure we increase the turnaround time for testing, make sure we can deliver this test from everywhere in the country. Not every village in Nigeria needs to have a lab. So as we set up new labs, we're improving our sample transportation system so we can get the test from where you are to the lab and get the results back to you. The success ultimately depends on testing the right people with the right indications at the right time. And that means that many people that want the test because they want to be sure cannot have the test. They need to stay at home. And if they have symptoms, call us, at least for now. Once we've improved capacity and increased our ability to test more people, then we'll invite all the worried well into the hospitals and give them as many tests as they want. But now we need to focus on those that need the test and make sure that those that really need it get it, and we can give them their results and start their care.
Yes, and we do hope that the people who need the test do get them. Dr. Ihekweazu, thank you. Okay, I'm hearing my producer in the ear now saying we should talk a bit about those Israeli nationals who were on their way out of Nigeria. Why are they leaving? You know, if we do seem to have things under control here in Nigeria.
So, Amarachi, I would not normally discuss any specific issue. However, you know, every country has a right to ask for citizens to evacuate them if they want to. Our role as NCDC is to make sure that anyone that decides to stay in Nigeria gets the best care possible. The Federal Ministry of Health and the Honorable Minister is leading this himself, ensuring that everyone that needs care does get care. We are managing the public health side. Everybody, this is really an all-of-government response. A few days ago, the Nigerian Air Force sent an airplane to the DRC or to Congo-Brazzaville to bring back 3 Nigerian healthcare workers, members of staff of NCDC that were stuck in Congo-Brazzaville. The entire private sector is chipping in from everywhere. So we really need an all-of-government, all-of-society response. And whether individuals are evacuating their citizens or not, really that is up to them. We encourage their efforts, but we need to focus on the response in Nigeria, make sure we get the best done for people that are in Nigeria at the moment. And that is the commitment that the entire NCDC staff and everyone in the Federal Ministry of Health and across government is working very hard to achieve for all of us.
Dr. Ihekweazu, thank you again for being with us tonight. We know the days have been longer, the nights have also been longer for you. Thank you to your team also. We all hope to get over this as soon as possible. Thank you again, the Director General for the Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu. Again, the lockdown is on Lagos State, Ogun State, and the FCT Abuja. Now, in part 2, after the break, the chairman and vice chairman of Fanfa Oil, Modupe and Folorunsho Alakija, donate 1 billion naira to support Nigeria's efforts at fighting COVID-19. Stay with us.